mean, you look at another fun fact. So let's start with patient no-shows because that seems to be a pain or a struggle that we feel almost every single day. So patient no-shows on average 10 to 20%, costing thousands yearly. And emotional oversteps, they're going to drain your team. And if it drains your team, it's going to drain you as a leader. So, and that would be like patients who are running late, then they come in and they expect the full treatment. Why can't you do, everything that was treatment planned? Why can't we do it in 35 minutes? I mean, it's crazy. Or they will vent on your team like they're a therapist.
Hey everybody, welcome back to another episode of Gloves Off. I'm David Rice. I'm your chief editor here at DentistryIQ with
Anastasia Turchetta.
Anastasia. What's happening today?
You know what? Right now it's rainy in Florida, but we'll take it.
Sometimes you need a little rain. I
We
remember having an
do.
awful lot of rain in Buffalo, New York, but Florida, much better. All right, listen, we've had two incredible episodes. Friends, if you've missed them, you need to circle back. We've talked about healthy boundaries between dentists and teams and dentists. We had a second discussion about boundaries between teammate and teammate. Those things are important. I love this topic because I feel like when we get really good at setting boundaries with each other internally, we're allowed to set boundaries between all of us collectively as a team and our patients. So tell me about healthy boundaries between us as a dental practice team and our patients.
It's so important, David. I mean, you look at another fun fact. So let's start with patient no-shows because that seems to be a pain or a struggle that we feel almost every single day. So patient no-shows on average 10 to 20%, costing thousands yearly. And emotional oversteps, they're going to drain your team. And if it drains your team, it's going to drain you as a leader. So, and that would be like patients who are running late, then they come in and they expect the full treatment. Why can't you do, everything that was treatment planned? Why can't we do it in 35 minutes? I mean, it's crazy. Or they will vent on your team like they're a therapist.
I
So you
hate the
have
dentist.
all of those
I
things
hate them.
going on, and there's zero, like that's a huge struggle where we really don't have boundaries. Instead, we tend to think like, well, we're not compassionate, we're in healthcare. But in dentistry, we have a very unique opportunity to set boundaries.
Okay, so like in a typical dental practice, say like how do you see that happening?
You see that happening. It's great when you train your team, and that would be different things that whether it be scripting or learning each other and understanding you as a dentist first. What do you want out of your practice? And then sharing with the team, being crystal clear. It's expectations, no blur boundaries. This is something that people can understand versus assume what is going to happen. Because once you assume, that's when things bad start to happen. People do get frustrated, irritated, resentful. Everything that baggage that we were talking earlier comes right on in. So I would say make sure that you have policies in place. You like the word process. I would say either policies or process, enforce those. Then, and that would include cancellations, late arrivals, and that's across the board. So everybody knows there are no surprises. That's another thing. And make sure that your scripting is empathetic yet assertive. Because the really cool thing with boundaries is it's not, you don't come at somebody as an attack or an ambush. It's never aggressive. You're coming at them with kindness, clarity, and assertiveness. So there is a difference in how you do that, but we are not taught that in our own lives. So of course, we're not taught that in dentistry. That comes with you being our leader and teaching us what happens when these things happen.
So is this like a good opportunity for a team meeting where maybe we all sit down together and say, hey, what are the top 10 places we feel like our patients push us a little too much, and then walk through like maybe best practices for verbal skills? How do we handle it with our language, but also maybe how do we lean on each other to make that better?
Absolutely. I think that's the best idea. It's trial and error, right? It's almost like,
Mm.
you look at different, even different stores. So let's say retail. How many times do people go, I know just from certain stylists that have told me, they have secret shoppers come in to see, was Anastasia offered water or was she offered this? And I find that so fascinating. And I know it's not a new concept, but if you can just imagine what would that feel like for different, people in the dental practice. So it'd be kind of cool just to see and, let's, trial and error, if you will. But I think that's really important is to get somebody whose expertise is that way and use the language that the team is used to, nothing that's foreign or where they're going to feel that it just doesn't fit. But as you and I know from traveling, there are scripts through certain, hotels or resorts, and across the board, everybody is saying the same thing. And isn't that delightful? You know what to expect.
Yeah, so I'm glad you said that because we just were at a conference together and sitting in a lobby where somebody who maybe was overserved and a little high with volume was having more than a discussion with another patron, and that hotel, the Ritz-Carlton folks, like they did things at such an elevated level that this gentleman felt good about being escorted away. And it was
Yes.
it was it was pretty brilliant. So scripting and practice, I know dental people, we hate to role play scenarios, but if we role play those top 10 scenarios that happen in our practice, like this gets easier, doesn't it?
It does get easier. And here's the thing. I mean, when you allow the patient late arrivals and then that adds stuff. I mean, it was kind of how we were talking in an earlier podcast of how when you start adding that level of stress, errors are going to be made. We don't know what that might be, and we're not intentional at it, but really, truly make sure that if it's a late arrival, it is about the time that you have allotted in that schedule, and make sure the patient understands across the board. I mean, I could tell you, I mean, for me, even with this woman getting hair maintenance highlights, I know that I'm in the chair for 2 hours and I know they need that 2 hours and I'm on time. And in dentistry, it just kind of feels like sometimes our patients don't value that time, and that's on us. So how do we, with compassion, share assertively, kindly, and clearly to say this is valuable because the time is not lost, but your culture could be lost.
That's great. All right. Parting words. Last bit of
Parting
wisdom.
words. You know what? Boundaries are so important because it isn't just the patient. The patient will sit in the chair, but boundaries will keep the practice upright.
Ooh, I like that a lot. Listen, thank you so much for being here. Friends, if you caught this episode, and I know you liked it, make sure you head back and you watch the episode that talks about dentists and team members and boundaries, and team members and team members have boundaries. I can promise you from firsthand experience that when you learn this skill set, and it's a learned one, life gets a whole lot better, and that culture does stand. Thanks for being here, buddy.